Imagine our immune system, which should normally protect us, mistakenly attacking and progressively destroying our nerves and brain. This is what happens in multiple sclerosis. It's a particularly dramatic disease because it can lead to trembling and weakened legs in marathon runners, cause designers to shake hands and struggle to hold pen, and even confine single parents to wheelchair. And moreover, early detection of the disease is very difficult because symptoms vary greatly. Therefore, we aim to highlight the most common 7 early symptoms and signs of multiple sclerosis. First, fatigue is the earliest and the most common symptom of multiple sclerosis. It can appear years before any other symptoms. This tiredness is not alleviated by rest, although we should remember that chronic fatigue is a non-specific symptom and not exclusive to multiple sclerosis. Second, tingling and numbness. Often one of the initial signs, tingling and numbness usually affects hands, feet, and face. This sensation feels like pins and needles in the limbs. Sometimes loss of feeling in the affected area is typically transient, lasting for several days and disappears without treatment. 3. Lhermitte sign. It means bending the head forward can trigger an electric shock-like sensation down the spine. This occurs because the immune system attacks the protective fatty tissue around nerves, known as myelin. When myelin in the spine is damaged, exposed nerves become vulnerable and oversensitive, causing this shock sensation upon certain movements. 4. Eye problems is another early sign, includes issues like blurred vision, double vision, or total vision loss, typically affecting one eye at a time. Involuntary eye movements, known as nystagmus, are also common. 5. Weakness and difficulty walking. Leg weakness and trouble walking is also early symptom of multiple sclerosis, often accompanied by muscle spasm. Initially, a person may limp slightly due to a weakness in the one leg. 6. Cognitive problems. Declined memory as well as difficulty with concentration and attention are the 6 most common symptoms. And 7. Bladder and bowel issues. Most commonly it means urinary incontinence, a sense of urgency, and constipation in many cases. To diagnose multiple sclerosis, several of these symptoms should be present. However, they should not all occur at once, but at different times, meaning they should be disseminated in both time and space. Magnetic resonance imaging is the most critical diagnostic tool for multiple sclerosis, as it can visualize lesions in the brain and spinal cord. Because exposed nerves die and dead tissue is called sclerosis, and it's in multiple locations, that's why it is called multiple sclerosis. The primary approach to treat multiple sclerosis involves disease-modifying therapy. Usually reduces inflammation and reduce autoimmune processes. There is no guaranteed way to prevent multiple sclerosis, but maintaining a healthy lifestyle and adequate vitamin D supplementation are significant preventive measures. Because multiple sclerosis is more common in North countries where vitamin D deficiency and limited sunlight exposure are prevalent issue. Multiple sclerosis is about 3 times more common in women than in men, and typically affects individuals between the age 20 and 40. Without treatment, the lifespan of individuals with multiple sclerosis can be reduced up to 10 years. However, identifying the disease early and starting treatment improves outcome importantly, preserves bodily functions, and extends lifespan.